Hi, everybody. Welcome to the Cancer Education Series, sponsored by MercyOne Cancer Center and Above and Beyond Cancer. And this video podcast is brought to you in part from a grant from the Iowa Cancer Consortium. So thanks for joining us. I'm looking forward to tonight. So I get to introduce you to my new best friend, Dan. So Dan and I just met earlier this year. This is Dan Noyce. Dan is from Des Moines, went to Valley High School, and got his degree in kinesiology at Iowa State University. So that makes Dan a kinesiologist, and you're going to learn what that is tonight. And Dan has really devoted a career to strength and flexibility training and working with all sorts of different folks, both athletes and individuals with illnesses, to how to make the body, stronger, more flexible, and really more functional.
Decided to go to Iowa State and start my college education. I actually had no idea what I wanted to study. I think probably both of my parents could attest. I was kind of focused on other things outside of that, having fun and playing sports and all of that.
Were you an athlete in high school?
I was an athlete in high school.
What were your primary sports?
Football was a primary sport. Ran some track up until senior year, and track was really to help facilitate speed in football. But we had a fun football career. We were state champs actually our senior year, which was awesome.
And your position?
I was safety.
Safety, okay.
Yep. So it was. Iowa State was great. I started out as a liberal arts major just because I had no idea what I wanted to do. But I had some friends that were going through the kinesiology degree, and to be honest, I kind of thought, hey, okay, kinesiology, I can go do PE type classes and play sports and learn about the science behind exercise and movement and all of that. So even I think when I declared to get my degree in kinesiology, I really didn't know what it was, but quickly learned that it's kinesiology is really just a study of human movement. And I think early on in college and even throughout college, Iowa State was great. I loved it, but it was a lot more the science behind exercise itself, which I was fascinated with. I really enjoyed learning about. But as I got out of college and started my career as a kinesiologist, I kind of dove into a little bit more of the actual human movement side of things, which is really where my passion is today. So.
Yeah, and when you get into a human movement, you can't separate, the mind, body, spirit, and the psychological and philosophical and emotional condition that one is in affects body movement.
Absolutely. Yeah. And I think one of the biggest perspective shifts for me, especially after leaving college and getting associated with this system known as functional range systems, which is really what I utilize to help people and educate people, give them the tools to be able to assess their own joints on a daily basis. With that information, allow people to determine when problems might be coming up with their joints, anticipate injuries before they occur, and really allow people to continue doing the things that they love. I think one of the biggest shifts, and going to your point, Doctor, was, today and, the year 2021 and even, the recent past, our normal way of life is really pretty abnormal for the way that the human body was designed. And I think that was a really interesting thing that I kind of learned, in that evolutionarily speaking, we were naturally selected to be hunters and gatherers, right? Where our entire survival depended on movement. So, we were nomads and we were having to walk to find places where food was, and we were having to run to get food, run away from things that thought we were food, carrying things and climbing and lifting heavy things. And, it's interesting because as we've started to advance as a species, we don't have to do those things anymore, right? We, our hunting and gathering right now can be, I can pull out my iPhone, sit on my couch and order Uber Eats, and I'll drop it right off in my front door.
And the amount of time that most of us spend sitting
Mm-hmm.
as our primary daily activity.
Yes, absolutely. Absolutely.
That's not what the human body was built for.
Absolutely. Yeah. And I think, because we, no longer do human-like things, running, jump, constantly moving. When you look back at the evolution of how exercise was created, exercise is really something that we invented as a way to compensate for the fact that, hey, we aren't getting the movement that we should be getting. We're sitting a lot, like you were mentioning, and most of us are getting exercise great for general health. And most of us are getting exercise 3 to 4 hours a week at best, which is, like I said, great for general health. But in regards to the health of our joints and our tissues and preventing injury, it just doesn't suffice. The amount of movement that we're getting just isn't enough.
Yeah, body's probably designed for more like 12 hours.
Totally.
Of movement
Exactly.
a day.
Yeah.
Before we talk more about kinesiology and movement, so Dan and I met because Dan is now teaching a course for Above and Beyond Cancer for cancer survivors. And we'll talk about that course. But every person I've ever met is, at most 1 degree of separation from someone who's had cancer. We've all been touched, and you shared with me that your life has been touched by cancer.
Yeah, it has.
Maybe share with us your father's journey.
Yeah, absolutely. I appreciate the opportunity to do that. I like to say, I've got a lot of people to thank that have helped me get to where I am. A lot of family, friends, mentors, coaches, you included, with Above and Beyond Cancer, and giving me the opportunity to share Kinstretch with folks. But I think highlighting my dad's story is great because he's got a really interesting story and really, is closely associated with cancer. My dad was born with a very rare bone disorder known as Olier's disease, which is basically characterized by, he was born with several tumors, benign tumors at that, but several tumors all over his bones. And that, led to some pretty significant challenges throughout his childhood, numerous surgeries. He was on crutches up until he was in middle school, and some physical deformities where his right leg was several inches shorter than his left leg. His left arm was several inches shorter than his right arm. So big challenges for him. And fast forward to about 2015, my dad had injured his knee, and he was kind of fed up with the way his legs were functioning. I mean, before his injury, he had 5 degrees of being able to bend his knee. So he had really no knees, essentially. And so once he injured his knee, he started kind of looking into, what it might look like to have both of his legs actually amputated, and are prosthetics maybe a better option. So he kind of started doing some research, and he came across a doctor in Australia that was doing some pretty cutting edge things with prosthetics and bionic legs, and pursued that a little bit, and got in contact with the doctor, and the doctor said, I need some x-rays just to at least see anatomically and structurally what's going on, what's realistic for you. And so my dad got some x-rays, which he had done, a few times a year just to ensure, benign tumors aren't becoming malignant. And gets his x-rays, sends them to the doctor in Australia, and doctor calls him later that day and says, I'm not an oncologist. I'm not an expert in this by any means, but I think you have cancer. I'm seeing a softball-sized tumor on your rib cage, and I'm seeing tumors in your right knee. And so he's going, obviously you got to get this looked at. So my dad goes to an oncologist, and sure enough, he was diagnosed with 2 different types of bone cancer. Somehow the softball-sized tumor was missed, and it wasn't aggressive, and doctors were thinking that maybe it had been growing for 10 or 20 years and was somehow missed. But that wasn't really the main concern. The main concern was the dedifferentiated chondrosarcoma, which was another type of bone cancer, rare and aggressive, in his knee. So my dad got connected with some doctors up at Mayo Clinic, and they pretty much right away had my dad come up, and they amputated his right leg almost immediately, left like a little bit of his head of his femur. And the intention was, hey, let's, amputate your leg, cut off the powerhouse of the rare aggressive cancer. But unfortunately, the cancer had already spread before the amputation to some lymph nodes in his groin. And so, my dad didn't really have many options from there with that type of cancer. Doctors are going, it's pretty resistant to radiation. I'm not an expert in this, but chemotherapy, they gave him 5 to 10% chance of that actually working. So my dad's really only option was to start seeking out alternative options. And he landed on boosting his immune system as much as he possibly could, and going kind of the all natural route of, no processed foods, pretty much no glucose other than, some organic blueberries. He was, exercise was a big part. Despite his one leg, he was swimming a mile a day, 5-6 days a week. He was, carrot juice and apricot pits, which with vitamin B17 and trace amounts of cyanide and thymoquinone and monard oil, all these different things that he had, learned that, in maybe smaller research and smaller data, but, had some chance of providing him with some sort of anti-cancerous activity. So it was working for a while, and doctors gave him just a few months to live on his cancer diagnosis. And he'd go up to Mayo and he'd have, scans, and they're going, dude, I don't know, but like, it's definitely not spreading. And it seems like it's maybe even shrinking. And this happened for about 1.5 years, where he was living high quality of life despite the one leg, and traveling the world and sailing and scuba diving and doing all the things that he loves to do. And it worked for a while, and eventually, cancer just took over, and he passed away in about 2 weeks once he started going downhill. But I just want to give a shout out to him, just in his attitude on it too, because he was one of those guys that's always like, look, you're dealt a hand in life that you can't control what hand you're dealt, but what you can control is how you play the hand. And that just really inspires me most importantly, as just a person that, goes through daily struggles. But I think professionally too, for me, looking at the human body is in the musculoskeletal lens, really looking at why are injuries happening? How can we prevent injuries from happening? And then, given all that information, how can I teach people to become their own health advocate, like my dad did, to be able to, take care of themselves, rather than kind of depending on waiting for injuries to happen.
And so, Dan, when your dad was diagnosed with a malignant bone tumor, where were you in your life journey?
So I was in Chicago.
So you were out of college.
I was out of college in Chicago at the time. Yeah.
And were you able to play a role in helping him develop a rehab program after his amputation and develop a exercise program?
Yeah.
Or was your dad so self-sufficient at that point?
Yeah, well, he was, it's a good question. I mean, he was certainly self-sufficient, but he'd be the first to admit he was self-sufficient because he had people around him that were smarter than him and knew things that he didn't, that he could gather information and input from. So, given the fact that so one of the things he really dealt with was phantom pain, and that, although he had like this much of his right leg, it felt as though he had his entire leg there, and that it was in serious pain. And so one of the things that I started having him do, that he learned pretty much days after I taught him from the prosthetic experts, were doing just rotations of his femur inside of his pelvis. And just, that was the only motion he could do, because he didn't have much of it. But just by simply getting movement in there, all the literature points to, hey, if you want to have a healthy joint, the one way to make a healthy joint is to move it. And so the fundamental motion of the hip is rotation. So he was all day, every day, rotating his femur in his socket. And then, we can go into a little bit later, but part of Kinstretch is looks at, prerequisites to movement. So do you have enough range of motion to be able to safely perform whatever activity it is that you love to do? And given that swimming was his thing, some of the things we were doing was making sure he had enough range of motion in his thoracic spine and his shoulders to be able to, safely perform that movement, because it was really the only thing he could do. And, there's chances of overuse injury and things like that. So it was ensuring that wasn't going to be the case.
So what does it feel like, either emotionally or philosophically, to have gone with your dad through his journey with cancer, and now here you are teaching a class to a group of cancer survivors?
Yeah, it's pretty surreal, to be honest. Even before my dad passed away from his rare cancer in Chicago, I was pretty heavily involved with an organization called Cycle for Survival, which is actually how I got in touch with Chris, the executive director here at Above and Beyond Cancer, because Cycle Survival was canceled due to COVID, and I was just curious of how to get some fundraising and kind of get the ball moving on something here in Des Moines. But Cycle for Survival was an organization that essentially is a fundraiser for rare cancers, and cycling is a big passion of mine. And Cycle for Survival became a big passion of mine, and just fundraising money for those that had no options. So it really became, Cycle for Survival became really personal to me, and fundraising for rare cancers. And then given now where I'm at, and meeting with Chris and leading into, teaching a class for cancer survivors and cancer patients, I mean, it's when I take the time to ponder it, it's really surreal, and I'm grateful to be part of it, to be honest. So
Yeah. Well, I'm sure the experience you had with your dad, especially how inspiring he was, and how philosophically, he took lemons and made lemonade, and as much as possible lived a full life, always reaching above and beyond, and not feeling sorry for himself, and to be able to take that philosophical lesson and then help spread that to others. Yeah.
Absolutely.
Well, let's transition a bit into talking a bit about Kinstretch. So first of all, maybe what is Kinstretch? What does that word mean? And what are the principles behind it? And who benefits from this type of practice?
Sure. Yeah. Great question. So, I guess I'll start with my son Luke, because I think he's a good starting point here. I've got an 8-month-old son who, him and my wife Emily might be watching at home. So hi guys, I love you. Unbiasedly, he's the cutest baby in the world. Maybe it's biased, whatever, but he's cute anyways. So, when to me, it's fascinating watching him develop in all sorts of different ways, emotionally, mentally, and especially physically for me. It's amazing to see the positions that he can get into. He's got a foot over his head, and he's got an arm behind his back and twisted all over the place. And, he sits in this perfectly upright posture in a splits position, 180 degrees, So, and then I've got kids or friends that have kids that are a little bit older that are walking around, and they can sit in this beautiful deep squat, their butt to the floor, and play around and dig in the dirt and all of that. And, it might sound crazy to a lot of us, and it did to me prior to getting into Kinstretch, but once upon a time, that was us. We were in the splits and foot overhead and deep squatting. And, I've got a friend that's a PT, and him and I talk about this a lot, that, most of us think that, hey, our range of motion and our ability to move freely and get into those wild, crazy positions, most of us think that goes away because of age. When you look at, the friend I was mentioning, who he at one point or another lived in Japan, and we were discussing this, and he's going, yeah, I'm seeing 80, 90-year-olds sitting in these deep squats like my 2 and 3-year-old kids can, so it's not necessarily age that takes away our range of motion, but it's really a use it or lose it principle. And that, hey, if when we stop going into those positions, then we start to lose our range of motion, and we can't access those positions essentially anymore. So, kind of going back a little bit to the whole, evolutionarily speaking, that's kind of how our Paleolithic ancestors were able to move as well. And we've started to kind of become deconditioned as humans, and our environment plays a huge role in that. Longer hours at work, and automation and technology, and it produces that sedentary lifestyle. But kind of simply put, our bodies just don't move the way that they should. And this is kind of where Kinstretch comes in. Is we say, okay, we know we need to move more. We know we need to exercise more. So, okay, I sit at my desk for 8 hours a day. I'm going to, take up hiking, take up yoga, lift weights, cycle, run, whatever it may be, which is all fantastic. But the challenge is that because we've adopted kind of the sedentary lifestyle, even if we are active, relative to way back when, it's a sedentary lifestyle. And because of that, we started to get stiff and tight, and our bodies just simply aren't prepared for those activities, no matter how good they are. So, I think oftentimes, and I'm certainly have been guilty of this several times, but rather than kind of looking for the cure of, okay, why did I get injured in the first place? We look for relief, and whether that's in the way of 10-second stretching that just makes you feel good initially, or it's cortisone shots or pain medication, or massage or chiropractic, and all of these things that certainly have their place. But the commonality between all of them is that it's going towards relief and not necessarily why did I get injured in the first place. And that's kind of where Kinstretch comes in. Is we're always in Kinstretch talking about prerequisites and saying all movements, hiking, yoga, whatever it might be, have prerequisites, where if your body doesn't have the prerequisite range of motion to safely perform that movement, then the result is injury. So I like to usually give a couple examples, if that's okay. Sure. The first example I'll give, just to kind of illustrate prerequisites, is let's say I'm a coach at a gym, and I've got my 6 to 7 a.m. class coming in. I've got 100 people coming into the class. And I'm writing a workout for all 100 people. It's going to be the same workout as in a group setting. And the workout of the day is going to be 100 snatches. And for those that aren't familiar with the snatch exercise, it's basically, and I guess I can do a quick little demonstration, but it's basically, let's say you pick up a weight off of the ground, you bend over, pick it up, you drive up, you catch it overhead in the bottom of a squat. Okay. Now, if we were to look at like what the prerequisites for that movement are, we'd say, okay, well, I need enough hip flexion, knee flexion, bending, and ankle flexion, dorsiflexion here, to be able to safely get into the bottom of the squat. And then additionally, I need enough shoulder flexion to be able to catch the weight overhead and to be able to hold it there. And I would need spinal control and segmentation to be able to extend my spine and be able to maintain an upright posture in the bottom of that. And what ends up happening is, let's say then I were to take those 100 folks that come in and I were to assess them. And I'd say, I want to assess every individual that's coming in, and I want to assess all of those prerequisites for the exercise that we're doing. And so we'd assess hip, knee, ankle flexion, shoulder flexion, spine extension. What we would probably find is that I would clear maybe 5 people to do that exercise, maybe. And what ends up happening is we skip that step. We skip the assessment. We skip, hey, do we have the prerequisites to safely perform that? And then we run everybody, because you're working out. You're trying to get a good workout in, right? You're trying to get your heart rate up, build some strength. You're not necessarily focused on like, do I have enough hip flexion to be able to do this exercise or not? And then what ends up happening is we get, we get injured, and we're confused as to, hey, what just happened here? But it's pretty simply, our bodies just weren't prepared for that exercise. And it's not that the exercise is inherently bad. It's just that our bodies weren't necessarily prepared for it. And I think the second example, I'll make it short and sweet. It's maybe a little more applicable, but we can take the push-up, for example. If we look at kind of the prerequisite for the push-up, great upper body exercise. You don't have to go to a gym to do it. You do it a lot in yoga as you go down in chaturanga. One of the prerequisites needed for a push-up is wrist extension, right? Because if you look at a push-up, ideally your wrist can have at least somewhere around 90 degrees of extension to be able to safely perform it. And if you can't do it, sure, you can choose to go forward with the task and still do a push-up, but what you're going to use is some sort of secondary motion. So because you don't have enough wrist extension to get into a push-up, then your elbow may do something funky, or your shoulder may compensate for the lack of mobility at your wrist. And then that's where it gets a little complicated, because now all of a sudden you're going, okay, I've been doing push-ups, I've got a shoulder issue, but really it's a wrist issue disguised as a shoulder issue. So what Kinstretch does is it provides you with the prerequisites that you need to be able to perform your activity safely, efficiently, and effectively without fear of injury. So it's literally for everyone, to be honest. It's for every individual that's active, that wants to continue being active.
So a part of it, I would imagine, is some sort of an assessment of flexibility. And would you say it's generally true or not true that if people are stiff, they're generally stiff at many different joints? Or do some people have great flexibility at certain joints and horrible flexibility at other joints?
Yeah, that's a good question. You do start to see patterns of where people have excessive movement and where people can't move. Like, for example, a lot of folks that I've seen, and again, I'm included in all of this, but a lot of folks, and again, a lot of it is the environment that we're in and sitting at a desk and whatever, but is that we lack a lot of upper spine, upper back mobility. And so because we can't move in those areas, we have to be able to move somewhere to accomplish whatever movement task we're asking. So I see a lot of folks at T12, which is kind of right in your mid back, T12, L1, kind of mid low back area, where folks get a lot of hinging there and can get a lot of movement there, but they're lacking movement below that and lacking movement above that. And so that's kind of goes to the wrist example of, hey, you've thrown your back out at T12, L1 because it's taking on more stress and more force, because the rest of the lumbar spine and the rest of the thoracic spine can't move and absorb that force that's going into it. So that's just kind of one common pattern. I would say hip and shoulder internal rotation are pretty stiff in a lot of folks as well, which is where we see premature arthritis coming in with a lot of teenagers and young adults, and obviously goes into more middle and older adult.
So as you're talking about these, so it's easy for me to visualize and do internal hip rotation, but I have to say, I don't know that my mind and proprioception allows me to tell where my flexibility is between T4 and T5.
Right.
I mean, obviously there is movement between each vertebrae that's stacked up, but that's not something I think I have much
you're not alone.
knowledge of.
Right. And I think to be honest, I think it's impossible without an assessment. Right. And so that's kind of one of the things that we did initially before we started Kinstretch with Above and Beyond Cancer was we did an initial pre-assessment where, and this is something I do with all of my one-on-one clients as well, is I commonly say, hey, don't guess, assess. We can make all these guesses as to what's going on, or we can actually assess what's going on and say, okay, based on your assessment, Here's where we're having trouble moving. Here's where we're maybe getting excessive movement from. Let's get those areas that don't move to start moving again, so that the force, stress, load, however you want to say it, is then dissipated evenly along the body rather than initially on one. So assessment is key for sure. And that's one of the things that you learn in Kinstretch is the first thing I teach people, whether it's the one-on-one or Kinstretch setting, is what their joints are. And just that little bit of an education. And we start with joints because that's where movement occurs from. The space between two bones makes the joint, and that's where we can move. And so we start with joints really because if we don't have the space inside of the joint, then we're stiff, we're fibrotic, we're not able to essentially move. So by starting with the joints, we say, okay, based on the anatomy of the joint, based on this is what the human shoulder is capable of doing, the human knee, the human hip, here's what the human joint is capable of. And then based on that, what I do is teach CARs, which is controlled articular rotations. And essentially it's an expression of how well your joint is functioning, how much access to your joint you have. And the idea is, for example, the shoulder joint, I want you to only move your shoulder without anything else moving to really get a true, honest, accurate depiction as to how much access you have to your shoulder. So this self-assessment is fantastic because it can allow you to kind of safely select exercises that might work better for you. So for example, as you go through a shoulder CAR and you start to come up and you realize, okay, and I get to this point here, I'm not quite overhead. I get to this point here and I can't go any further with my shoulder. I can keep going if I bend my elbow, but shoulder wise, I can't go any further. So this would be a good idea for an individual that, presents like this to say, okay, maybe overhead stuff right now isn't the best idea. We'll build on that and get you to get overhead within a Kinstretch class, give you the tools to be able to learn that yourself. But for now, maybe instead of pull-ups, something like an inverted row would be a better option until you start to own that overhead range of motion.
So, and don't want to get ahead here, but, I think of, so a joint, obviously, as you defined, it's two bones that have a space in it, but there are obviously to make movement happen at a joint, we have muscles, and we have muscles that have tendons that attach the muscle to two different bones. It allows then with the contraction for movement to happen, but then we also have ligaments that kind of hold the joint together, and so muscles can get stiff and tight, ligaments can get stiff and tight. So the fact that one has a limit of movement from what is normal for the joint, that limitation can be because of stiffness of muscles or of tendons or of ligaments. And I suppose it could be also that you have some fundamental arthritis, which is, in the joint itself. So as part of Kinstretch to improve flexibility and strength, do you think the process, and probably all of the above, is it working fundamentally on the muscles or the tendons or the ligaments or the joint itself?
Sure. Yeah, that's a great question. This was a big perspective shift for me when I kind of learned this because traditionally when I learned anatomy at Iowa State and even kind of early on right after Iowa State, and you would know this better than me for sure as a doctor, but and I was able to do a couple of cadaver labs and the textbooks, and traditionally you learn anatomy as individual structures with individual functions, right? Where this muscle originates here, inserts here, and has this action. And what was a huge perspective shift for me, and I mean, it still is, I think, but it shows just the complexity, and it gives you a much just a great appreciation for the just the beautiful design of the human body. When you get down to the cellular level of, you know, what most of our body is made of is connective tissue, right? So bone is connective tissue, skin is connective tissue, fascia, which, you know, covers the muscle and is intertwined in the muscle, is connective tissue, and the muscle doesn't live independent of that fascia, so it is in a sense connective tissue. Tendon is connective tissue, ligament is connective tissue. So the fact that at a cellular level, all of these things are connective tissue, which are really made of three components. And the difference between, say, bone versus a tendon is they're made of, for the most part, the same three things. It's just changes in composition of those things. So cells, fibers, ground substance make up connective tissue, and then bone has more fibrous-like things, more fibrous-like stuff than, say, a tendon has more, you know, ground substancey, fluidy type stuff. So I guess what's interesting and what's really a fundamental principle behind Kinstretch and functional range conditioning and all of that is that, you know, it's they joke and say, you know, it's all stuff that turns into other stuff and it's made of the same stuff, essentially. So it all kind of bioflows together. And so when you're stretching, say you're stretching your piriformis, for example, you know,
Let's use a muscle that people know where
okay,
it's at.
sorry. Yes. Yes, fair enough. Yeah. Let's say you're stretching your glute.
There we go.
Your butt cheek there.
Everyone knows where their glute
Thank
is.
you. Yeah.
We might get different
Appreciate you
opinions about where your piriformis is.
You're right. Yeah, he said what? So let's say you're stretching your glute. You're not necessarily just stretching like one targeted muscle, but you're stretching the nerves that innervate it. You're stretching the tendons, the ligaments, and all that. And that's kind of why we get all the way down to the joint level, because ultimately everything ends up turning into those two bones, and then the capsule that kind of connects the two bones, the joint capsule. And that's that capsule, the closest, deepest level of the joint, the deepest tissue of the joint, is the first thing that registers movement. So our muscle isn't really the first. When I start to bend my elbow, my bicep muscle isn't the first thing that registers that I've started to bend my elbow. It's really the deep capsule tissue that registers it first, sends those signals up to my brain. Brain really doesn't know anything about what's happening in terms of movement. It's dependent upon our body telling it where it is in space through receptors. And then our brain takes that information in, and then it tells our body, you know, oh, you need to slow down. You're about to enter a danger zone of injury, or whatever the case may be. And I think, you know, kind of touching on one last point of your question, Doctor, it's really interesting when, I don't know if anybody watching has had an ACL reconstruction, but typically what ends up happening in an ACL reconstruction is that, you know, the surgeon will take a piece of tendon, or maybe a tendon, but oftentimes maybe the patellar tendon, which is the piece of tissue that attaches your quadricep, front of your thigh muscle, to your kneecap, or I guess becomes. But they'll take a piece of that tendon and they'll place it as your new ACL, and that's your new ACL. And immediately after that, if we were to look at that ACL in the microscope, you're going to see a tendon. But then 3 years later, we look at that same ACL and you're going to see a ligament. And what's interesting is that the force that we're actually feeling, like how we use our body, really dictates what tissue that our cells basically produce, or what our cells tell that environment that it should live in. So it's the same thing with like osteoporosis. You say, I'm losing bone, you need to do weight-bearing activity to start to build bone back up. So you do weight-bearing activity, apply force into the bone, and the cells of the bone say, oh, okay, yeah, I need to make more bone due to that extra force that's going on. So, yeah.
Let's shift a little bit. We talked about how we were going to do this. I think we need a little bit of practical application.
I like it. Yeah.
Okay.
Perfect.
So let's move the tables. Let's have you do a little mini assessment.
Sure.
And then some actual exercises to work on,
Sure.
strength and flexibility.
Definitely.
So they kind of go hand in hand, right?
Absolutely.
Right.
Absolutely.
It's you can't just have flexibility. You can't just be a wet noodle.
Right.
And you can't just be a muscle bound, rock. You've got to
Absolutely.
have the ability to be flexible and strong.
Absolutely.
Okay.
Yep. I love it. Let's do it.
Okay.
Are you my demo man?
Well, do we have a studio audience member? We do. We have a studio audience member. Come on in.
Come on up.
So this is Poon Tigas, and Poon is a cancer survivor and participates in many above and beyond cancer. And so let's move stuff out of the way.
Perfect.
And Poon is a great sport and engages in lots of different physical activities, does many different classes. And so Poon, why don't you tell us a little bit, like during the course of a regular week, what classes do you participate in terms of engaging in physical activity, or not necessarily even classes, but what do you do in terms of physical activity to keep fit?
Spin class once a week with Dr. Deming, aqua class 3 times a week, and urban pole walk, and I do that about 3 to 4 times a week, once with an instructor and 3 times on my own.
So hiking, walking, aqua exercise, and cycling.
Yes,
Yeah.
little weights.
So before Dan assesses you, so do you think you are flexible or stiff?
I am currently stiff.
Okay.
A little extra hiking over the weekend.
Gotcha. Yeah, a little.
So that piriformis was tight.
So delayed muscle soreness and stiffness, and okay, and when you like your legs, do you think it's more calves, quads, or hamstrings? Where do you feel stiffness the most?
In the quads.
Okay, we'll turn you over to Dan.
Perfect.
Okay.
Quads it is. It's a popular one anyway, so awesome. Well, thank you for being a participant. So what we're going to do, what we typically do, especially in a one-on-one setting, which will be a little bit different than Kinstretch. In Kinstretch, the majority of our assessment is going to be simply CARS based, but as anybody that's done a Kinstretch class can attest, there's really the entire class is assessing and exploring your own body and learning by yourself. So we're going to go to the floor if you're okay with that. So what I'll have you do, Poon, is actually lie on your stomach. If you want to go head that way and feet towards me, we're going to assess a couple different things with the quads. Now, most of the time we do assessment, we'll either just do a passive or an active assessment, but it's really important to do both because the ratio actually matters. Depending on what we find in the assessment, that can then dictate what the actual input that we need to do to improve said knee flexion or quad health. So what we're going to do, Poon, is I'm going to actually bend your knee. You can just stay relaxed here for me. And we're going to look at a true assessment as to how much passive range of motion you have. Passive being you're going to relax. I'm going to be the external source that's going to take you into a stretch. So I'm going to go ahead and you just stay nice and relaxed. Take a couple breaths, nice slow exhales. In through your nose, out through your mouth. And what I'm going to look at is just, I want to get a real honest evaluation as to how much knee flexion you have. The main compensation we're going to see is that your pelvis is going to want to move when we start to run out of space. Okay, so you stay as relaxed as you can. I know it's tough to do, but just keep breathing slowly, nice and relaxed. I'm just slowly moving Poon into her passive range of motion, or really how flexible she is. So far, pelvis is good. Oh, Poon, I don't know. Tell you, your quads are pretty darn good here. Passively, at least here. So Poon's pelvis has not moved yet, and I am all the way to her glute with her heel. So we cannot get any better than that passive range of motion. So now, Poon, what we're going to do is I want to assess your active range of motion. So remember, you got all the way here with your quad. You're going to very slowly, you're going to follow that same path that I just took you on. And you're going to go nice and slow, and I'm going to have you stop when your pelvis moves, because that's where we've run out of space at the knee and we're starting to kind of get secondary motion. So you go ahead nice and slow. Let's kind of pause there, take kind of a reset, take a breath there, and then nice and slow, maybe an inch per second. So far, so good. Can you go any further, or are you running out of room?
Usually I go like this.
Well, that will be our passive. Yep, we did that. That was good. I want to see how far you can go actively. So now Poon's using her hamstrings to curl her heel into her butt. So I got to say, that's pretty good. You can't get any flexible than you already are, for one, and you've got a pretty good ratio between your passive and active. Poon, I want to test your hamstring because, to be honest, that's fantastic. So let's test your hamstring. I'm going to have you lie on your back here. And what we're going to do now is go same thing. We're going to test your passive range of motion and your active. Same idea. Pelvis, we want to stay motionless. You just stay nice and relaxed for me. I'm going to move you up into a passive range of motion. Nice and relaxed. Go ahead and relax your leg for me a little bit more. Perfect. Same thing. We're going to go up as high as you can without your pelvis moving. You just stay nice and relaxed. How we doing, Poon?
Good.
Doing okay? Getting towards the end, or are we doing all right?
Yeah, towards the end.
So we are going to call that right about there. That left leg starts to get a little movement. So this is your passive range of motion. Now what I want you to do is go ahead and do the same thing on your own power. Take it nice and slow. I'm just going to monitor your pelvis, keeping your knee nice and straight. Yep, you're doing great.
So I use that.
Yes, for the stretching, yeah.
So is that a good idea?
So that would be your passive range of motion. Poon just asked if she uses a band to stretch. Absolutely. If flexibility is what you're going for, absolutely. So what we're looking at is the difference between passive and active range of motion. So passive, I'm pushing you. Active, you're pulling on your own power. This is the amount of usable range of motion you have. Sure, you can stretch way back here, great, right? But between your flexibility and your mobility, your passive and active, this is kind of the injury zone. Your brain thinks you can get all the way here, but really you can only control to here. So Poon, you are doing fantastic. Honestly, I have nothing to actually change with what you got going on. So what I want to do is take you through a hip car, which is something we do in class, okay? So I'm going to have you lie on your side for me. If you want to just lie on your bottom arm, and you can actually, yeah, you want to do want to stay a little even here. So you just lie all the way down on your right arm here. Now what we're going to do is actually go through a hip car. We were talking about cars a little bit earlier, but this is an expression of how well joint is functioning. When we look at the hip, we say femur inside of the socket of your pelvis. So we want the pelvis to have no motion, and we want to see how much access Poon has to her hip. So what I'm going to have you do here, Poon, is I'm going to have you flex your ankle here, and I'm going to kind of gradually walk you through this and just guide you, but you're going to be doing the work, okay? If you want to push your left hand down into the floor, that's perfect. Get a little leverage. Poon's hips are going to be stacked, and what I'm going to have you do here, Poon, is very slowly start to pull your left knee up towards your chest, only as far, and you're going to go as about half a mile an hour on this. You're going to pull your knee up to your chest as far as you can go without your pelvis moving. Nice and slow, controlled. Good. Continue going. If you got it, good. You can get elbow out of the way. Perfect. Excellent. So this is hip flexion. Think bottom of a squat. Something definitely needed for that. Cycling, prerequisite of. We about at your end range there, Poon?
Yeah.
Perfect. Now I want you to keep your knee up to your chest. That's hip flexion, going through all the actions of your hip. Now what I want you to do is go to hip abduction. So you're going to use your outer glute tissue here to start to lift your leg up towards the sky. And I'm going to keep you locked in here so that your pelvis doesn't move. Keep lifting, keep lifting. Good. Freeze there. Let's take a nice big exhale. Stiffen your abs for me. Good. Abs are going to keep your pelvis locked. Can you go a little higher? Right there. We're about running out of space here. Perfect. Now what I want you to do here, Poon, keep your leg right where it's at. We've done flexion, abduction. Now what I want you to do is go into internal rotation. So your thigh is going to spin in. Good. Keep your knee high. Keep spinning, internal rotation. You're doing great. Keep spinning, keep spinning. Keep that knee off of my finger if you can. Yep. Keep spinning, internal rotation. Keep lifting your knee up towards the sky. Good. Keep that rotation going now, Poon, and you're going to use your glute and start to kick your leg back towards me. Keep your knee bent. Perfect. Pelvis is locked in. Got some good shaking going on. I love it. Keep rotating right here, thinking rotation as you glute kick back. Keep your abs nice and tight. So we've got hip extension now, big prerequisite for running, walking. And then from here, Poon, you're going to keep trying to kick back behind you as you use your inner thigh tissue to slowly lower your knee down towards the floor. Nice and slow. Keep your knee bent at the same angle all the way through, so we're all hip. You're going to lower your knee as low to the floor as you can. And once you've run out of room there, Poon, we're going to reverse directions. We were halfway there. I promise we're almost done. So now, Poon, we're going to reverse it. Kick back again. Keep your knee bent here for me. Perfect. Keep pelvis locked in. And then what I want you to do is use that outer glute again to lift your knee up to the sky. There you go. Lift, lift, lift. Keep lifting. Keep lifting. Keep lifting. You sweating yet? Keep lifting. Keep that. Let's bend your knee a little bit more for me. Keep that knee at about 90. So right here. Can we bend for me here? Perfect. Keep lifting up here. Last bit we haven't hit is external rotation. So now, Poon, you're going to spin your thigh this way. Continue to rotate. Keep your knee high. Keep rotating. Keep pelvis locked in. Keep that rotation going here. Keep rotating. Good. And as you rotate, Poon, I'm going to have you bring your knee up towards your chest and continue to try to rotate your thigh this direction here. Keep rotating. Pull knee up as high to your chest as you can. Beautiful. See if you can rotate your hip more this way. So we're going to get more external rotation. There it is. Beautiful. Keep externally rotating. Knee towards your chest. Beautiful. And then we'll slowly lower knee back down on top of your bottom knee and you can relax. Beautiful. Thank you, Poon. How are you feeling? Is that okay?
Yes.
A lot of hip, right?
Yes.
Yeah. Well done. Thank you. I appreciate it.
Awesome. Great, Poon. Yeah, that was very helpful to see that.
Good,
Tell you
good.
what,
Yeah,
let's have a seat here.
absolutely.
Yeah, to assess it. Now, obviously, if you're doing this in a class with lots of folks, you're trying to get them to understand the movement without necessarily you being hands-on. I can see how a one-on-one session would be incredibly important, maybe for part of learning to understand, even though as part of my training, I know the difference between abduction and adduction and internal rotation. Those words don't always translate from the brain to the body for everyone.
Absolutely.
And then that's just one joint,
Right.
but you probably don't just focus on one joint per class.
Absolutely. Yeah, absolutely.
So how do you go about teaching a group class?
Yeah, it's certainly more difficult for sure. But one of the things I'm always trying to kind of reiterate every class is that, hey, in class, we're here to really just practice what you hopefully have already been doing. So the group we've got now with Above and Beyond Kinstretch, we're doing incentivizing doing your cars every day. And so, people are tracking those and hopefully doing them every day. But you can tell as a coach, week one, as with anybody learning, a lot of us really don't know where our body is in space. So first time you're doing them, you're going to feel lost. I was lost. Absolutely, for sure. You're going to feel lost, but it's the practice makes perfect kind of thing. And less is more initially. It's hard to isolate one joint at a time, but starting small, just getting perception of those tissues first before actually trying to increase range of motion. And as we go through this 12 weeks of Kinstretch through Above and Beyond Cancer, we're 6 weeks in and already seeing some pretty awesome results. And I'm not having to go around as much and all of that.
So you touched on your 6 weeks in, you're seeing results. How much time of working? Let's say you do the class once a week, you do your homework. When should you expect to see some improvement, and what do you perceive as improvement?
Yeah.
Do you perceive more range of motion, or do you perceive better balance? What is the perception you have that things are better?
Yeah. So I think improvement starts with just more perception of your tissue. Let's say hip internal rotation is something a lot of folks never do. So just feeling what it feels like to rotate your hip like that is the biggest indicator initially. And then we're looking at improving range of motion, because if we think about range of motion as really the base rate for movement, if I've got range of motion of my joints and can move freely, then I can do anything better with more range of motion, whether it's, cycling, swimming, hiking, running, whatever it might be. Skiing, exactly.
Yeah.
Yes, absolutely. Climbing.
Understanding,
absolutely. So, range of motion after perception and feeling things, and 30 hours spent on an area of your body is what you can kind of expect. So, you spend a couple hours a week or a couple hours or an hour a day, let's say maybe, or 10 minutes a day, or whatever is realistic for you. But it could be anywhere from 4 weeks if you're putting in a lot of work and being diligent, or it could be more like 10, 12 weeks if you're kind of just throwing it in every once in a while. But certainly we'll be seeing some big results in the 12 weeks.
Great.
For sure.
Great.
So,
well, Dan, thanks so much for number one, for teaching the class for Above and Beyond Cancer. Thanks for sharing it with our audience. And if anyone watching wants to become part of the Above and Beyond Cancer Kinstretch class, all they have to do is reach out to Above and Beyond Cancer at aboveandbeyondcancer.org, and you'll be able to sign up for our Kinstretch class. And so hopefully we'll keep people coming and help improve flexibility and strength one survivor at a time. Huh?
That's right. Absolutely.
Thanks, Dan, for being with us. And
Appreciate
thanks to everyone for joining us. If you know someone that isn't with us tonight and would like to watch this, or you want to watch it again, this has been recorded tonight and is available at the MercyOne Cancer Center website, or you can go to the Above and Beyond Cancer YouTube channel and watch this again. And please come and join us again next week. Thanks, everybody. Good night.